Talk to Turró, the public health expert and emergency coordinator at the International Federation of Red Cross and Red Crescent Societies. Eva, welcome. Give us a sit-rep, if you were. I mean, how do you see, what are your teams telling you on the Ebola outbreak in the DRC?
Hello, thank you so much for the invitation. The situation is extremely concerning. As we speak, the outbreak is still expanding, and today the UN describes its progression as exponential. But what it's really concerning is that the transmission is continuing across a very large and super complex geographical area. So this is not absolutely the moment to lower our guard. We need to intensify the response, identify the cases as early as possible, and crucially work with communities and to put the communities at the center, as today we passed more than 5,000 cases.
Why are people attacking health workers?
We need to understand that every epidemic creates a lot of fear, creates a lot of rumors. We saw this in previous epidemics like COVID-19, for example. So we don't want to blame the communities for not understanding. What we need is to keep continuing doing the work that we do, for example, in the Red Cross, to be inside the communities to explain them. Because when the information is not there, the rumors take this gap. And this is when our response becomes more challenging.
I wonder, what lessons from COVID might be applicable in this scenario in the DRC? I mean, when you look at Uganda, for example, and its successful response to Ebola there.
Uganda, they detected the cases very early. So early detection is completely key. For us, we started with already a month of delay. So that created a lot of challenges. But if something we learned from COVID is that rumors can spread faster than any disease. And the misinformation, it's extremely concerning. So again, we need to understand that every thing that we put for the communities, they need to own this. We need to make sure that the communities are understanding what is happening and that we put them in the center.
Is there any sense of vaccine hesitancy in this story?
For now, what we are hearing is other type of concerns, more on different perceptions on what this disease is, and some of confusion. For now, we are going to follow what the government and WHO recommends. And for now, we are centering our volunteers, again, to make sure that the communities are prepared to face the next phase of this outbreak.
Eva, good to talk to you, and every good wish with your plans there. Eva Turró, the public health expert at International Federation of Red Cross and Red Crescent Societies.